I'm sure you're hearing from all the hospitals around the state. What is the state of hospitals in Texas right now as far as capacity and beds?
Listen, we constantly work in collaboration with those hospitals to make sure that their capacity needs are met. And what we do as a state is we surge medical personnel to the hospitals that need it the most. You all probably have spoken about the status of El Paso maybe for several weeks now. The good news is this, and that is for the past several days in a row, hospitalizations have gone down in El Paso, as well as the number of people testing positive. The same thing is true with regard to a decrease in hospitalizations in Lubbock, Texas. Those were the two hottest of the hot spots. And then as we onboard these antibody therapeutics, first the Eli Lilly that we began distributing this past week, what that will do, that will decrease the number of people who will be going into hospitals in the future. Then, of course, with the onboarding of the Regeneron drug that should arrive shortly. And so we are working our way through and managing the hospitalization process while also working to contain the spread of COVID-19.
Okay, now we're CNBC, so I'm going to shift back to business. Are you going to, I know you said it recently, but I'm going to ask you again, Governor, given the surge, are you going to re-lock down or tighten controls on the Lone Star State?
First, no more lockdowns in Texas. Second, we had a plan in place before this most recent outbreak, and what that plan entailed was that if one of our 22 different hospital regions in the state of Texas has a hospitalization rate of 15% of total beds occupied by COVID patients, that leads to an automatic ratcheting back of the openings to 50% across the board, as well as closing down bars in those regions. And so we planned this out in advance about what would happen if there was an increase. And it has led, for example, to that decrease in spread in El Paso, and I think the decrease in spread in Lubbock, causing those locations to get better already.
Governor Abbott, I wanted to ask you about this election and the transition. A number of business leaders and increasingly Republican politicians have come out publicly and not just congratulated President-elect Biden, but called for President Trump to finally concede. Chris Christie, his advisor, called the legal efforts at this point a national embarrassment. Where do you stand?
Well, I stand in the position of always wanting to see what the numbers look like in each individual state as they move toward the time of the Electoral College. Remember this, and that is a presidential election is different than any other election. It doesn't matter what a media outlet says. It doesn't matter what I say or anybody else says about calling the election. The election for president is not called until the Electoral College vote counts. And along those lines, you see that there is going to be an additional recount in Georgia. You see that there's ongoing litigation in Pennsylvania, and we need to wait and see how all of these issues filter out. The good thing is there is a timeline in effect for all of these processes to come to an end, and that timeline is coming up very quickly.
Governor, though, just to follow up, given the pandemic and this crisis that we're living through, do you believe that it is incumbent upon the Trump administration to begin at least provisionally working with the transition team that President-elect Biden has put together?
For one, I wouldn't be surprised if they are, but for another, you all need to understand this, and that is it's not as if the Trump administration has stopped working on this and is incapable of providing a handoff. As one quick example, the governors have been meeting with the White House coronavirus team on a constant basis. Our next meeting is this afternoon, where we're going to be talking about the distribution, both of these antibody therapeutics as well as the vaccines that are coming down the pike in just a couple of weeks. And so we continue this ongoing process with federal agencies. Secretary Azar is going to be the leader of this today, talking about how we will be distributing this. And think about this. There will be a month of distribution of vaccines before the inauguration even takes place.
Hey, Governor, we just heard from Jim Cramer, who did raise some concerns about the states each having their own plan for how they distribute this. What is your plan, and will you be ready to go, and how will you decide who gets it and who doesn't?
So it's not so much that each state has their own plan. The states began working on the vaccine distribution plan with the White House coronavirus team several months ago, and we have finalized all those different plans. And first, there's a strategy about who receives the vaccines first, and that is those who are most vulnerable, as well as the frontline healthcare workers. And then internally within the states, we have our own distribution networks already set up. We have known months in advance that the vials of the vaccine are already in place. That was part of Operation Warp Speed, and those vials are ready to be sent to us the day after the emergency use authorization is provided, and we are expecting to be able to begin the distribution process as early as December the 12th.
Shepard Smith here. Thanks for watching CNBC on YouTube.